Is HRT safe? For most women, yes. And last November, the FDA made it official. They removed the most serious warning label in medicine from hormone therapy after 20 years. So why were you told it was dangerous? Why did your doctor refuse to prescribe it? And why are most women with menopause symptoms still not getting treatment? Because one study from 2002 scared the entire medical system into abandoning you. And for 2 decades, nobody corrected it. I'm going to break down exactly what that study got wrong, what the FDA just changed, and what HRT actually does, so you can make your own decision with real information, not fear. The Women's Health Initiative drops a bombshell. Hormone therapy causes cancer, heart disease, every news outlet runs it. Overnight, millions of prescriptions get pulled, and doctors stop offering HRT entirely, and women are told to just deal with it. Nobody mentioned the fine print. The Women's Health Initiative enrolled women who were mostly in their 60s and 70s, many of them already 10 or more years past menopause. They used one type of hormone at one dose with zero customization. And then the entire medical system took those results and applied them to every woman at every age, at every stage. Think about that. A 47-year-old woman, drenched in sweat every night, can't sleep, can't think, watching her quality of life collapse, and her doctor says, sorry, too risky. Based on a study about women 20 years older than her, using a formulation that's no longer the standard. That's a system that stopped asking questions 20 years ago. I've had patients who've lived through exactly this. One woman in particular, 5 years, 3 different doctors. She kept being told it was stress, anxiety. She ended up taking an antidepressant, but she was a healthy 48-year-old woman who needed her hormones replaced, and the system gave her Zoloft instead. In November 2025, the FDA did something they almost never do. They reversed themselves. The black box warning is the most serious safety label the FDA puts on any medication. It's the one they reserve for drugs that might really hurt you. And for 20 years, it sat on every estrogen product in the country. Based on a study the FDA now says was misapplied to the wrong population. Here's what the data actually shows. For healthy women who start HRT within 10 years of menopause, the HHS cited a 50% reduction in heart attack risk, a 64% reduction in cognitive decline, and a 35% lower risk of Alzheimer's. So if a doctor shut you down, you weren't being dramatic. The science was always on your side. The FDA just finally acknowledged it. So what are we actually talking about here? What does HRT do? HRT replaces up to 3 hormones: estrogen, progesterone, and testosterone, customized to your body, not the same prescription for every woman. Estrogen is the hormone that drops the most dramatically during menopause. It doesn't slowly taper, it falls off a cliff. And when it does, the effects hit everywhere: your heart, your bones, your brain, and your skin. Estrogen is one of the most powerful anti-inflammatory molecules your body makes, and losing it is not just uncomfortable, it changes how your body protects itself. Here's a number that might bother you. The average man has higher estrogen levels than a menopausal woman. Your husband has more estrogen than you do. Progesterone is your stability hormone. It's what helps you sleep through the night and keeps your nervous system from running in overdrive. When progesterone crashes, you get this wired exhaustion. You're tired, but you can't sleep. Anxious, but nothing happened. Emotionally reactive in ways that don't feel like you. The reason this matters is that most women experiencing these symptoms are told it's anxiety or depression. It's not. It's a hormone that used to be there and isn't there anymore. And then there's the ones that almost nobody prescribes. Testosterone. Women need testosterone. It drives your energy, your motivation, your ability to build and keep muscle, and honestly, your desire to have sex at all. Most HRT clinics, even today, skip it entirely because it's a controlled substance, and it adds complexity they'd rather avoid. We prescribe it to the majority of our HRT patients because we're not willing to give you what I consider 2/3 of a treatment and call it done. The women who get all 3 hormones often describe it the same way. I didn't realize how much of myself I'd lost until I got it back. That's what we hear a lot. Menopause is straightforward to define. 12 months without a period. If you're there, you know it. And if you're dealing with hot flashes, sleep that's fallen apart, brain fog, or libido that's disappeared, this is for you. And you don't have to wait for a full 12 months of symptoms before starting treatment. If the clinical picture is clear, we can start addressing it. We take an individualized approach. Your treatment is built around your symptoms, your history, and your goals. Now, if you're having periods, but everything feels off, that's perimenopause. It's the years leading up to menopause, and it can start in your late 30s or early 40s. Your body feels hijacked, and nobody can tell you why. Here's what most women don't realize. You don't have to wait for menopause to start treatment. In perimenopause, which comes before menopause, progesterone and testosterone alone can often make a significant difference, stabilizing mood, restoring sleep, bringing back energy and drive. And here's something most women don't know. The best way to diagnose perimenopause is not blood work. Your hormones are swinging too wildly during perimenopause for labs to catch it. The real diagnostic is a provider who listens to what you're going through and recognizes the pattern, not a single blood draw on a single day. One important note, if someone has had certain recent cancers or is well past the 10-year window after menopause, treatment can look different. That's a real conversation that needs to be had with a real provider. But for most women in that window, the science is clear. Most of our members report real improvement in hot flashes and sleep, and many feel the difference within the first few weeks. Those are women who stopped accepting just deal with it as a diagnosis. At Fountain, it's $35 for a full evaluation with a real provider. Video call, custom treatment plan, everything from your phone. And treatment shows up at your door in days. We diagnose and treat based on your symptoms. And if you don't qualify, we refund your $35, no questions asked. You've waited long enough. The science caught up. The question isn't whether HRT is safe anymore. The question is why nobody offered it to you sooner. Link in the description.